So we did start getting a lot of calls from employers, from their employees, from the family members of the employees. The governor's order is fairly broad, and he really is asking each of us to sit down and look at those orders and think about the business that we do. And if we're working for the health, the safety, or the infrastructure, those services that we all need in order to be able to take care of ourselves and our families, those are the things that need to be happening. We might have a manufacturer here in Delaware that part of the company is producing something very valuable that's definitely in that trail of infrastructure importance, but maybe there's another part that's not. So maybe be creative and think about, well, can you do a split shift so you don't have as many people there at the same time? Maybe bring some of those people from another service to kind of fill in those gaps. If you do have to be on some sort of an assembly line, we've got to get those people stretched out. We've got to give them an opportunity to wipe down their areas and use the hand sanitizer and, go wash your hands. So that we really need people thinking about that. We've got a lot of frontline employees in the grocery stores, in the pharmacies that need to be there to take care of you. So the more we can do to keep ourselves well, even then when we have to run into the pharmacy or run into the grocery store, less of a chance that we're going to expose that worker that has to be there, less of a chance we're going to expose them. Even here at the health district, we have about 80 employees, and we've put everyone on split shifts. The places that they do have to work together, like our call banks, we've actually got measuring tapes out, made sure that we're 6 feet apart from each other. We're wiping down the desks. We're wiping down the phones. Mark is our maintenance custodian. He's making sure all of our doorknobs and our stair rails and all of those things are wiped down. We are open for essential services. People can drop off permits for us. One of the essential services that the governor has defined is if we are helping to build homes or do building type things or, permits to get, plumbing done, that we as a community are allowed to continue to do that. So we do have our plumbing inspectors out, but they're outside. They're not standing close to someone. We are taking permits, but that's all being done, through a drop box. We're open for immunizations. This is a time where we don't want someone getting another disease that's definitely vaccine preventable. So we do have a nurse on and we have an assistant on for her. But again, 6 feet apart, good hand washing, not in the same offices. So, we've always said that if your health department's doing their job, they're a really well-kept secret. Nobody knows that we're here when we're doing our job, and that's okay. That's what we're supposed to be doing. It's our responsibility to make sure that the infrastructure of our safe community is always what we do. And so I think it's a lot like that now. We're not the ones in the hospital. We're not putting our lives on the line every single day to take care of the sick person. But what we are doing, and the folks that are in our phone bank or our epidemiology disease response team, what they're doing is making sure that that person who's not in the hospital, and thankfully all but one of our people that we're watching are not in the hospital, but we're making sure that that person's okay. We're checking in with them every day. We're making sure that anyone that they came into contact during what we would consider to be that infectious period, we're making sure that they're okay too, and we're checking up on them, and we're making sure that they have their needs met. We had a family the other day that needed somebody to go pick up some medications, and so we made arrangements to go get those medications for them. And, if we had somebody on quarantine and they said, I don't have any food, then we would make arrangements to make sure that they did have that, because the best thing that they can do is stay where they are. And so it's our job to make sure that that can happen. Our phone bank people, which are made up of staff that aren't necessarily what we would consider our public health scientists. I mean, they're all public health, but they're not our nurses or our epidemiologists or our sanitarians, kind of those of us with that science background. but they're answering a lot of questions, and they're trying to be that calming voice when somebody just doesn't really know what to do. And that's what we want to do. We don't have all the answers. I wish I did. I've been in public health, like I said, a long time, and I was given that crystal ball when I first became a health commissioner about 16 years ago. And it happened because we'd had a really bad flu season, and the flu vaccine didn't come the way that it was supposed to. And I said, I just wish I'd had a crystal ball, and then we would have known who to save that vaccine for. And so when I left my job, my health commissioner gave it to me, and I leave it on my desk to remind me that we don't have a crystal ball. We don't know what's going to happen, but all we can do is use the science that we have to address the issues that we can. I think Tracy's doing an amazing job getting really, really good information out there, and Megan's keeping us all up to date with our social media, because we know that misinformation, not that it is as dangerous as the COVID-19 viruses, but it's really dangerous because it sends people into this panicked feeling. And I think that's what we all need to remember is we really do have this. We may not know all the science, but we do know that if people stay home, if they make that essential grocery run and they go out and they get everything they need at one time and they wave to their friends across the aisle instead of getting this close to them to have a conversation. We know people are checking on their older neighbors and making sure that they have what they need so that they don't need to get out. We do have the ability to really slow this down. And I know that many of you are watching Dr. Acton and on the conferences in the afternoon, and Governor DeWine, and he's brought in several experts to talk about various things, but we all have a part to play in this. And yes, we're so thankful for the nurses and the doctors and the EMS workers and our law enforcement partners who are out there doing their regular jobs, but each of us in our whole community can really have a huge impact on this if we just stay home. Make those trips out as valuable as we possibly can, and then go back home. We know that if we stay home and we stay away from people to the best of our abilities, we have a great chance of maybe not getting rid of this, maybe not stopping the curve at all, but keeping that curve down to a manageable number to give our healthcare workers in the hospital and our public health workers that are out on the front lines a chance to really make a difference here. But we all can make that difference. And I guess that's what I want to tell people. You all are as important as we are. It may seem like the nurse or the doctor or the EMS or us working here that we're the important people, but we're not. It's all of us working together. I think the message I would want everybody to remember is that they are important in this. They're important to us because they're our community members, and our job is to protect them. But they are also important because everything they do can protect their neighbors and their loved ones, help to protect us, help to protect the nurse and the doctor that are there on the front lines. So every one of us has a part to play in this.